So the homework week 1 Monday, I gave you guys the access code. So the way we'll go over it is I gave you guys 2 each. I'll just have you guys read your answers, and then we'll make the corrections. We'll help each other out. And then the last 6, we'll do those together. All right, so this is PHR208, homework week 1 Monday. So very similar to the blended. All right, who had question 1? Go ahead and give us that one for LIV. Yeah, very good. So the verb is infuse, and we just leave all the units the same when they're IV. So infuse 4 liters intravenously. Very good.
Just type it like it is?
Yeah, just like that. Infuse 4 liters intravenously, just like it is on the board, perfectly. So we got our verb, our amount, number, and our dosage form. All right, number 2, go ahead, read that one for us.
Take 2 teaspoons full of
Yeah, very good. So the verb is take. DR is a dram. That's the same as a teaspoonful. So take 2 teaspoonfuls by mouth. So just be careful where you put the S. It's going to be after the N. Teaspoonsful.
Can you clarify the indications of putting the S there and when not to put the S there?
When it's 1, it's no S. So 1
really the only
teaspoonful, yeah.
Okay.
And then 2 teaspoonsful. Spell check won't like it, but that's going to be the correct way.
Okay.
So 1, no S, more than 1, put the S in. All right. Next person, number 3. Oh, okay. So I'll read it for you. So unwrap and insert 2 suppositories rectally. Yeah, very good. So remember to tell them to unwrap and insert. You'll have to give them both verbs. Unwrap and insert 2 suppositories rectally.
How you spell that?
Suppository. Unwrap and insert 2 suppositories rectally. Number 4, IM is into the muscle. Again, anything IV, we're just going to keep the same units. So we will inject 6 milligrams into the muscle. The verb is inject. 6 milligrams into the muscle. Number 5, Anthony.
Unwrap and insert 1 to 2 suppositories rectally.
Yeah, very good. So again, suppositories, both verbs, unwrap and insert 1 to 2 suppositories rectally.
Number 6, take 2 capsules by mouth.
Yeah, very good. So C will have multiple meanings, so you got to read it in context of the entire SIG code. So in this case, it's just C for capsule. PO, verb is take. Take 2 capsules by mouth. Take 2 capsules by mouth.
The other meaning for C is with.
With, yeah. All right, number 7, very similar.
Take 1 capsule by mouth.
Yeah, so this one is just 1 capsule by mouth. Super easy.
And then take 1 tablet under the tongue.
Take, what's the verb?
Place.
Place, yeah, we want to place. Well, make sure we place this guy, because if we say...
Yeah, when I read that, it said that out loud or something.
Yeah, because if we take, we're going to swallow. So we want to keep it there until it dissolves. So place 1 tablet under the tongue. You can also use the verb dissolve. Dissolve 1 tablet under the tongue. So whatever your pharmacist prefers. Place 1 tablet under the tongue. Number 9.
Take one tablet by mouth.
Yeah, very good. Take 1 tablet by mouth. 10. What is the household units? Yeah, so 1 ounce is 30 mLs. So the household unit is 2 tablespoons full. So just be careful on that one.
Which one do we put? Do we put the 1 ounce or the 2 tablespoons?
2 tablespoons full. So take 2 tablespoons full by mouth. So we always want to use household units, something that the patient will have readily available at their home. 2 big spoons and you're good to go. Number 11.
Inject 12 milliliter intravenous push.
Yes, very good. So IVP is intravenous push. The verb is inject. Inject 12 milliliters intravenous push.
Apply ointment on affected area of left eye.
Yep, very good. So ointment to eyes will apply ointment to the affected area of the left eye. OS. O is ojos for eyes. So apply ointment to the affected area of left eye. Apply ointment to the affected area of the left eye. Number 13.
Apply 1 vaginally.
Apply 1, we're going to say
Or
applicator full. So A-P-P-L-I. C-A-T-O. Full. Applicator full. Apply 1 applicator full vaginally. So this is going to differentiate from tablets. So tablets we're going to insert vaginally. Applicators we're going to apply 1 applicator full vaginally.
14 take by mouth, 13 fluids.
What's the household unit?
Table.
Take.
Tablespoon.
Yeah. So make sure you have it in the same order. Always in the same 6 order. So take 1 tablespoonful by mouth. Take 1 tablespoonful by mouth.
It's okay if we put TBS full.
Write it out completely because this is for the patient. They may not know the abbreviation for teaspoonfuls or tablespoons. So write out the complete word, no abbreviations. And if they're English second language, that's going to trip them up even more. So no shortcuts for deciphering. Take 1 tablespoonful by mouth. All right, home stretch. Only a few left to go. IVP is intravenous push. What is the verb? Inject. So how do you know if it's inject or infuse?
Over a certain period of time.
Inject is in a syringe. Infuse is in a bag. 15 is going to be inject 10 milligrams intravenous push immediately. So that just means now or immediately. Inject 10 milligrams intravenous push immediately. So for these last few ones, we're going to have some additional information. Intravenous push immediately. Number 16, take 1 to 3 tablets by mouth. So here they have the choice of taking 1, 2, or 3, depending on their mood, I guess, their needs. Take 1 to 3 tablets by mouth. All right. Now we're going to get the complete SIGs. All 6 elements for the last few ones. All right, 17, what's the verb? Take. We're going to take 1 tablespoonful by mouth 4 times a day as directed for 8 days. So very good.
Take 1 tablespoonful
By mouth 4 times a day as directed for 8 days. So once you guys get the hang of it, it's going to just be like reading a sentence. Take 1 tablespoonful by mouth 4 times a day as directed for 8 days. What is IVPB? Piggyback. Is that a bag or a syringe? It's a bag. So the verb is going to be infuse, right? So ask yourself that question to get the correct verb. 250 milliliters intravenous piggyback, and just like the rest says, over 3 hours, every 6 hours.
piggyback, right?
Piggyback, intravenous piggyback, over 3 hours, every 6 hours. Infuse, 250 milliliters intravenous piggyback, over 3 hours, every 6 hours. Nineteen is usually insulin. So the U in this case are units. Sub-Q. What is sub-Q? Under the skin. So what's the verb? Inject. Right? So inject 50 to 60 units under the skin, this time 3 times a day, after meals as needed. Inject 50 to 60 units under the skin 3 times a day, after meals as needed.
After meals.
Yep, PC is after meals as needed. So we have AC, PC. Just remember AM, PM. AM comes before PM, so AC is before meals. PC is after meals.
So you always gotta look at the middle first before you get the.
To get the verb, yeah. Yeah, to get the verb, look at the route. The route is usually the first thing you want to look at. So for 20, it's in the eyes. So you have to look at the route and now the dosage form. So drops. How do we use drops? We instill, right? So we're going to instill 2 to 3 drops into both eyes every 4 hours as needed for pain. Instill 2 to 3 drops into each eye every 4 hours as needed for pain. All right, the next few ones, let's do them together. All right, so EDS. What does EDS mean? Estimated days supply. So if we give them, how much is LXXV? How much is that? That's 50, 60, 75. That's 75. How much can they take in a day? I-ISSTPOQ 6 to 8 hours as needed for pain.
3.
So what's the most they can take? 1 or 1.5? 1.5, right? So I do 1.5. How many times can I take 1.5?
Every 6 to 8 hours.
So how many doses is the most?
6 hours.
So every 6 hours gives me 4 doses. Every 8 hours only gives me 3. So we go with the max. So in a day, how many can they take? 1.5. 1.5 times 4 is 6, right?
Okay.
So you can take 1.5, 1.5, 1.5, 1.5, right? Throughout the whole day. You can do it 4 times. 1.5, 1.5, 1.5, 1.5. That's 6 in a day. So how much did we give them to start with? 75, right? And they take how many in a day? 6. How many days would that last them? We'll divide that. Do 75.
Like what, 12, 13?
75 divided by 6, what do you get? 12 point something. Let's round down to 12. So just put in 12. So that's how you want to tackle it. So you got 75. Just put in the final answer. I'm just doing the math for you guys. And you just divide it by how much they take a day. And our answer is 12. So just enter 12. So this is how we did the math. We gave them 75 here. And we just divided by the most they can use in a day. And just round down to the nearest day. So these are preview questions. In this case, the doctor didn't tell us how much to give them, but they gave us EDS. They said, hey, give them 15 days worth, which is EDS, but they didn't tell us how much to give them. So how much do we need to give them? So how many mLs are they taking per dose?
5 mLs per dose.
5 mLs per dose. How many times are they taking that 5 mLs?
QID.
So QID is 4 times. So they're taking 5 mLs 4 times for 15 days, right? So all you gotta do is multiply
300.
all that together. 5 times 4 times a day times 15. And you got 300? So you guys just enter in 300. So we need to give them 300 mLs to last 15
So we
days.
put mLs or just 300?
Just 300. Just the numerical. So 5 mLs per dose, 4 doses in a day for 15 days, 300 mLs. 23 is flow rate. The units of flow rate is mLs over hours. So in 23, how many mLs do we have? We have 500 mLs. And we divide by, it says over how many hours? 3. So that's it. So take 500 divided by 3. What do you guys come up with? So round to the nearest ml, it would be 167. So just enter in 167 in your answer box. So take the mLs, 500, and divide it by the hours. And the SIG tells you, put it over 3. Round to the nearest ml. 24. We got to do a couple steps here in 24. So this is insulin. Insulin comes 100 units per ml. Right? So that's the strength of insulin. How much insulin do they take in a day?
75, 80.
So what's more? 80, right? How many times do they take 80? 3 times. So how much is that all together?
Where do you get the 340?
Q8H, right? Times 3. So TID, so that's 240 units. So in a day, they need 240 units. So how does insulin come?
100 units per
So all you got to do is divide by the strength. So if you need 240 units and your drug comes 100 units, just divide. 240 divided by 100 gives you 2 point, and you're there already, so you don't have to round. You're already at 0.1. So for you guys, just enter in 2.4. So just figure out how many units you need in the whole day and divide by your strength. So order over supply. We'll do that next week. All right, last one for the day. EDS for eye drops. So we're gonna estimate that every ml of this eye drop bottle, so it's a 3 ml bottle, you can get 20 drops. So 3 mLs at 20 drops per ml is a total of how many drops? Very good. 60 drops. So that 3 ml bottle gave us 60 drops. How many drops do they use in a day? So what's more? 1 or 2? 2. How many ears? 1 or 2? Just 1, right? Sometimes it's 2, so you gotta multiply by 2 if it is. So it's 2 drops. How many times a day? 6 times a day. So that is a total of 12 drops in a day. So we gave them 60 drops. So 3 mLs times 20 is 60 drops. They use a total of 12 drops in a day. So this is gonna last them how many days? 5. So just enter in 5 for your answer box. So just double check your answers. before you submit, and I'll look at the fill in the blank ones manually. So just give me a moment after you submit to get them in.